technology, okay, how it's playing a crucial role in healthcare delivery. Now, whatever we are thinking, whether we are for or against this healthcare technology, we can't stop it now. It's here. Okay. So this is the reason why I'm talking to you, because I've also seen it in action as well. Okay. And there are some good points to this, providing it's being used in the correct manner, for example. Okay. So it does enhance patient care, and also it helps with communication, enabling a better access to healthcare services. So I'm going to talk to you about some of the roles that it can actually play. So telemedicine, we've all heard about this, haven't we? Remote monitoring now. Since the COVID situation happened, we are now in this technology arena, should I say. So technology enables remote healthcare services. It allows patients to consult with the healthcare professionals through video calls, phone calls, or even online platforms. Remote monitoring devices collect patient data, such as their vital signs, and transmits it to the healthcare provider, which could be the hospital, or it could be the care home, for example. It could be the supported living accommodation. It could be the care provider as well, depending on what the service is. Okay. So it enables proactive interventions and reduces the need for hospital visits. So looking at the disparities around the globe, as well as the economic, business, and staffing factors shaping the healthcare market. And we're going to go into this now, because you need to make sure you're making notes as well, although you're getting the video, but I'm going to ask a question and you'll need to answer it in order to win the prize. And whoever wins the actual prize, but it needs to be the first person that has said in the chat, whether it's on Facebook or Zoom. First person that does that, like the winner of yesterday's one, you need to be the first person to actually win the prize. Okay. So there's significant health equities, which is causing problems across the globe. Many low to middle income countries face challenges in providing equitable access to healthcare services, resulting in disparities in health outcomes. Factors such as poverty, lack, infrastructure, inadequate healthcare workforce, and limited resources contribute to these disparities. So, social factors, social economic factors. Social economic factors play a crucial role in health equity and access disparities. Income inequalities, educational level, and social determinants of health, i.e. housing, nutrition, sanitation, can impact individuals' access to health services overall, causing health outcomes. So marginalized populations, including racial, ethnic minorities, communities, rural populations, often face greater barriers to accessing healthcare. So you could be in a rural location and your access to healthcare is limited as well. So healthcare infrastructures. In healthcare infrastructures, including hospitals, clinics, healthcare facilities, can also limit access to quality care. Many low-resource regions lack sufficient healthcare infrastructure, resulting in long travel distances, overcrowding, and limited availability of medical equipment and technology. So business, economic, and staffing factors shaping healthcare. Private sector engagement, the involvement of private sector, including pharmaceutical companies, medical device manufacturers, and insurance providers, shapes healthcare markets. Their pricing, strategies, innovations, and influence on policy decisions impact healthcare access and affordability. And this is not just the UK, but America as well as around the globe. Okay. I'm referring to global as well. So healthcare workforce, staffing shortages, distribution of healthcare professionals, and workforce migration can impact access to care. Inadequate staffing in certain regions or specialities can create barriers to timely and quality healthcare services. And we're seeing this globally around the world. It's not just in the UK, it's not just in America, it's global. Okay. So this is the reason why the technology and innovation has really come in. Advances in technology innovation have the potential to improve healthcare access and outcomes. However, the cost of adopting and implementing technologies can create disparities, as some regions or populations may not have the resources to leverage these advancements because it costs a lot of money. It's not cheap to have these technologies come in. So if you're already strapped, then how are you going to pay for this? So, there's two ways of looking at this.